Hi, this is Steve Barsh from Dreamit. Welcome to our webinar on scaling a digital health startup. We're going to be talking with two Dreamit Health founders today. We'll give it a few minutes for everyone to log in. It's the correct time, and I'm in Philadelphia today. Thank you for joining us. Again, we'll give it a couple minutes for everybody to log in, and then we're going to get started and talk about scaling digital health startups. And we'll have two founders with us, Mindi from Kaizen Health and Hari from Yosi. Mindi is in Chicago today. I would assume Hari is in New York today, at least where they're based. And we'll get started in just a minute or two while everybody logs in. Thank you for joining us again. This is Steve Barsh from Dreamit in Philadelphia today. Thanks for joining. We'll get started in one moment. Okay, let me take down this screen and stop sharing this screen and get started so I can see what's up. Hold on, we'll get started in one moment. Excuse me. Okay, there we are. Yep, got it. Great. All right, welcome again. We're going to talk about scaling your digital health startup. Thanks for joining us today. We have both Mindi from Kaizen. We have Hari from Yosi. Mindi, are you in Chicago today?
I am in Chicago today.
Sounds good. You need to just speak up a little bit more. And Hari, I take it, are you in New York City today?
Yes, I am, Steve.
Okay, if you both of you can just speak up a little bit, we'll hear you a little bit better. Your voices are a little bit faint. So I just want to give the quick backdrop of what we're going to be talking today. Both Mindi and Hari went through Dreamit. Mindi really recently, Hari about a year and a half ago. They're building some really interesting digital health companies. We'll talk to them about some of the challenges they've been facing, some of the ways they've been scaling, how they've been getting their early customers, which is in the enterprise health space can be very challenging, selling to enterprise health companies. We're going to talk about that, talk a little bit about their journeys and some of the things they got out of Dreamit, but more importantly, how they're doing as a company and how they're overcoming obstacles in building great companies and increasing sales, which is always a big thing. I wanted to get started. If you could, we'll start with Mindi and Hari. If we could do some quick introductions. Let's start with Mindi. If you can start off, please, a little bit about yourself and what Kaizen's doing, a minute or two, just so we understand who you are, where you're coming from, and what your company's all about.
Sure. My name is Mindi Knebel, and I'm the founder and CEO of Kaizen Health. Prior to Kaizen Health, I had been either on the founding team or an early employee of 5 startups, all in varying industries. So this has sort of been what I've done for most of my career, and it's a lot of fun. Kaizen Health, we are sort of reinventing the non-emergency medical transportation broker. So not just getting cars moving around better, but being able to work with the payers and the providers to check eligibility and to ensure that all the patients get to and from the medical treatment that they need.
Okay, great. And just to give an idea of traction, like how many rides are you doing per month, or how many hospital systems are using you today?
Yeah, we've got 8 customers here in Chicago. We actually just gave our first ride at the end of December of last year. We've made a lot of traction in the payer space as of the last month and a half or so. Now that we've got a budget here in the state of Illinois, that's been very helpful with the managed care plans deciding to stick around. So that's been really great. We recently brought on the University of Chicago, which has been really awesome. They decided that they did not even want to do a pilot with us because they had heard such good things from their colleagues at the hospital systems here in Chicago, and have now 400 of their staff members on our system, and they're training them all up with launch in September. We're doing some work in the behavioral health space up in McHenry County, which is great because it's getting into the more rural areas and getting folks to counseling and to pick up their pharmaceuticals every day. So making a lot of traction there. Philly is our next market. We've got a handful of customers lined up ready to go there. We will be launching there in September or October.
Awesome. Awesome. Great. Hari, could you tell us a little bit about yourself, what you're doing, what Yosi's doing to get us started, please?
Sure. Good afternoon, Steve, and it's a delight to share our experiences with others that are on the webinar.
Okay, and if you could get a little closer to your microphone, it's a little bit hard to hear you, or speak up a little bit.
Is it better now?
Yep, probably. Yeah.
So my name is Prasad. I'm the founder and CEO of Yosi. We're a New York-based company, and we are very proud Dreamit company as well. We started in 2015. Our core purpose and mission is to improve efficiencies in healthcare, make it paperless, and provide a better patient experience. So we offer a pre-visit mobile-based patient check-in solution. And we have a number of paying customers today all across the country.
Okay, and can you disclose approximately how much or how many how many hospitals are signed on with you now, either in pilots or full paying customers?
Sure, Steve. So we're right now deployed in about 85 independent clinics. We have two pilots up and running in two major health systems. Unfortunately, I'm not in a position to disclose their names. You know them. And we've also got full integration partnership with 3 of the top 10 EMR companies in the country.
Okay, great. Okay, terrific. So thanks for the intro, just so people have an idea. There's about 70 people on with us right now. Hopefully that'll grow, but just to give you a feeling of the number of people that are listening in, and then there'll be people watching it offline as well. Let's start a first question. It sounds like things are going pretty well for you both. I know it's still in the early days. Your companies each are just a couple years old. It'd be interesting to hear, the first thing is, what do you find are some of the biggest challenges you faced that you find are maybe unique to building a healthcare company? Could be anything, but maybe Mindi, we can start with you. What do you feel maybe are one of the 2 biggest challenges you faced in building your company? And it could be independent of sales, but I'd just love to know what you feel they've been.
Sure. I mean, I think some of the early challenges was finding that initial customer or 2. For us, we're really fortunate that we're replacing an archaic process with one that is much better. So we're not trying to change a behavior or really institute something that a person isn't already doing. So we've been very fortunate in that way. But finding customers to really learn from to build the product, and we were very fortunate. Mount Sinai here in Chicago, opened their arms to us, let us talk to their staff, to the patients, and really understand from their perspective. And I would say the other challenge for us is, we have a lot of constituents that are involved in our process. So we've got the transportation providers, and we needed to understand their challenges and what worked well for them, what did not work well for them. We had the insurance company understanding, the fraud and what they were trying to gain by offering, medical transportation. Of course, talking with the healthcare systems and the clinics, and then really most importantly, the patients, because if the patients weren't satisfied in the process, they oftentimes weren't showing up for those rides, which meant they're not showing up for appointments. So it really took some time to understand the whole process all the way through.
So some of the things that we went through when we were scaling our business, Steve, was that we were hoping our customers or potential customers were more open to embracing the change that we're bringing to their organization, right? So we had to overcome that. And the second challenge we ran into is the pace with which they operate. We're a startup company, we're very nimble, we're very quick, but oftentimes we don't see that reciprocated from our customers because they are naturally larger organization. So that's another challenge that we're running into.
My apologies, I dropped off there for a minute. You guys there?
Yes, we're here, Steve.
Sorry about that. My internet connection dropped. Totally my fault. Mindi, I did hear 95% of that the early first 1 or 2 customers were some of your biggest challenges. And then you were talking about the as well. What was the ending part of that as well?
Well, just that it involved a lot of constituents.
A lot of constituents, that's right.
And it was really important to understand all of their needs to really build a process and a product that was going to fulfill everyone's challenges.
Okay, cool. So let's hold there. I want to go over to Hari and hear from him because I want to build from there about then how do you scale? What did you do in the beginning and then how you've been scaling? Hari, what have been the 1 or 2 biggest challenges for you, in building your company over the last couple of years? Maybe unique to a digital health company, maybe not.
Right. Sure, Steve. So two challenges that we ran, into. One was our potential customers being open to change, right? Because as entrepreneurs, what we're bringing is change. So we just needed them to embrace that change and be open and willing, right? The second challenge we run into today is the pace with which they operate, right? So as a startup, we're very nimble, we're very quick. But they might not be so because they are larger organizations, right? So that difference in the pace is something that we constantly grapple with as well.
Okay, all right. So that's a great starting point that you both mentioned that. So let's build from there. Could you talk about, and either one can take this, so I don't want to always do it in the same order. So how did you get that initial customer? What was that pitch like? And I'd really think about your initial customers you had, and now as you're scaling, right? So Hari, you're in 85 clinics. Mindi, you're in 8 hospitals through the Chicagoland area. You're not at the first customer anymore. Could you talk about, because some people on this webinar probably are just getting their first commercial customers where others are truly scaling it. Could you talk about what those first couple of pitches and meetings were like to get your first customer? And then let's go, and you can also integrate right into that. How have things changed over the last year as you start to scale the number of customers? Either one of you, who would like to take it first?
I'm happy to take it.
Go ahead.
So the first few months into our company, right? So a lot of the time was spent in understanding the customer needs. What were the problems that they were going through? How can we address those problems, right? So that's really where we learned a lot about our business model. That's really where Dreamit helped us tremendously in terms of fine-tuning our business model. So once we did that, we had those initial few customers, and then naturally as a company, we've evolved into identifying the right customers for us, right? As you can imagine, when we were getting started, anyone that was willing to try our product, we were happy to go with them because they were being our beta customers. Now as we mature as an organization, we're looking to identify the right customers so we can sell to them and have them leverage and provide the benefits to us as a customer as well. So our thought process has changed from initially selling to anyone and everyone to now qualifying them as a customer and identifying the right customers. And our pitch has actually changed. Initially, we used to talk about the virtues of the product all the time because we were so proud we built it. So we naturally need to understand, what are your needs? How can we help you? How can we add value? That's change has made a tremendous difference for us as well.
Okay, I want to build on that answer. We'll do it in a minute, but one of the other things I wanted to restate, it sounds like you've really refined, like, who is our target customer? It's not just anybody who comes in, but who are we looking for, hunting for? How do we identify it? What are the characteristics for an ideal customer? Has really matured over time, correct? It sounds like. Okay, Mindi, same question for you. What were those first pitches like, and then how has it evolved over time? Because I want to really get into the scaling side of it, because I know a lot of people came to this webinar to like, I want to scale my digital health startup, not just get it started. So could you talk about the first pitch or two, those first couple of key customers, and then how have you been changing that process over time?
Yeah, so the first couple of customers, we were very fortunate to, have some introductions into. I was very fortunate to be working at Matter here in Chicago at the time, and I had a lot of availability to providers and payers, and so those initial conversations were more casual and trying to understand their problem and really listening. They were very excited that someone was listening to their problem, and we could kind of identify some areas, the low income, aging populations, the veteran populations, where we knew that these folks were going to struggle with transportation largely. And so those were sort of the healthcare systems we were targeting initially. From there, as we started working with those initial customers, we really focused on the ROI. We really took some time to dig in, with their operations and finance folks to understand, where is the ROI for these patients? It's probably not just getting the average person to their annual checkup, but it's, getting folks to those high value appointments. It's those high cost, high risk patients, making sure they're getting to preventative care. It's the discharge space. So, radiation oncology, dialysis. So as we sort of learned some of the areas that were particularly challenging, that was easier for us to focus in those areas after we went to new customers from there.
Okay, great. And so when you think about that as you scale it, can I ask, have you both gotten to the point where you think of it, there's marketing, you create top of funnel leads, you then qualify those leads, you start bringing them down a sales process and funnel. Could you talk about your sales process and how you've scaled that, if you have? I don't know if you have, 3 people, 10 people, or 1 person still doing kind of business development sales. Could you talk about your process and how you've scaled it, if you have? Hari, could we start with you?
Sure, Steve. Our marketing process and our sales process continues to evolve today as we scale our business, right? So we are now starting to generate a lot of inbound leads, where last year we were not generating inbound leads, right? So our salesperson was calling the clinic's code, right? So you can imagine the results we get from those approaches. So we've now evolved as an organization, and our approach has also changed. So now what we're doing is identifying those strategic target customers. We're providing them enough information to learn about the problems that they face, how our solution might address the problem. So inbound lead coming in, now we qualify the lead, and then we have a natural infrastructure built within the company to have the right handoffs, not just from marketing to sales, but also from sales to technology and technology to implementation.
Okay. And do you have almost like a pre-sales person that qualifies? Do you have 2 or 3 salespeople now that are dealing with leads, but are you at that stage yet? Or is it a qualified lead comes in, there's a salesperson, they take that lead, hopefully from lead to closed deal or pilot? Is it one person, or is it a tiered kind of approach?
It's a tiered approach that we have, Steve. We have different folks in the company that's responsible for different aspects of it. Some of them are responsible for doing live demos with our clients if they're interested. Some of them are focused on qualifying the leads. So we all play different roles in the in the sales discussion. And a lot of it is also optics, right? Sometimes I, as the CEO, would come in and say, I'm happy to jump on the call to answer any questions and how we can close this. So just having some of those optics has made a big difference for us as well. As the CEO, you tend to do everything yourself. Right. It's not a scalable approach.
Okay, great. Mindi, let me ask you the same question. I'm coming back with Hari to level it up a little. Mindi, process, are you at the point of you qualify, you have an inbound lead, you have multiple tiers? Last time we saw each other was probably 3 months ago. It wasn't that long ago. But you can talk about the process itself and how you've been scaling it, if you have.
Yeah, so our approach is slightly different in that we have folks attacking different areas of the business. So we've got one person selling into the provider side, one into the payer side, one into pharma, in-home healthcare, and senior living. So we sort of have verticals, and that is how we are approaching sales at this point. We're not at the point where we have enough staff to have multiple staff within each of those verticals, but we were able to utilize some pretty amazing interns over the summer to give us a sense of that, which was pretty awesome. They are out there qualifying leads for us and giving good leads. We've also honestly been very fortunate to have a lot of inbound referrals from other systems and payers that have been working with us. So that's the process to this point.
Okay, and then Hari, so you've done it on verticals. You have specialists that are like, these people are dealing with pharma leads, these people are dealing with payer. Hari, have you taken a similar approach? Have you segmented out where there's a few different people doing sales, and some are doing clinics, some are doing healthcare systems? Have you done any segmentation to help scale your business?
Sure, Steve. So we do look at the market as different segments, and we have different folks focused on certain markets. For example, any forward-looking advanced clinics or organizations, right? We have a certain team that's going after them. If it's an internal clinic or primary care, if it's a larger health system, we have a different person going after those organizations as well. One of the things that's worked out very effectively for us is our channel partnerships, right? As an organization, we understand we don't need to always do all of this by ourselves. If we can strike some strategic partnerships, right? that can really help us scale the business. So we also have a couple of dedicated folks going after building those channel partnerships for us. And that's been very effective so far.
Okay, that's great. And we, I know we've talked to both of you, or I have in the past, channel partnerships sometimes are a double-edged sword, right? You get a channel partner and we're already selling to that customer, but can you get their salespeople? Have you both dealt with that or overcome that? Because sometimes you have a channel partner and like our salespeople are already calling on those hospital systems. Yeah, but are they really going to be interested in delivering sales for the startup? It's just one more thing. Hari, have you overcome that, successfully? It sounds like you have.
Correct, Steve. What has helped us, in managing those channel partnerships well is that we're still in charge of the sales process. We're still, selling the product ourselves. What these channel partnerships that we've struck so far is helping us introduce the potential customer as a lead, and that's the extent of our channel partnerships. So we're still taking the onus on of selling ourselves.
Okay.
So
in the channel.
For us.
So the channel partnership for you more is lead gen, but you're doing closing the sales. They don't have to. Okay. And Mindi, by any chance, are you using any channel partners for what you're doing?
In a very similar fashion, we've just begun to go down that route. So it's been only a few months now, and we are doing the same where, it's really lead gen that we are taking over. So I wouldn't say that we've mastered the sort of channel partnership avenue yet, but we've at least put our toe in the water there.
Cool. And there's some questions coming in. If people want to ask questions, if you use the Q&A function, there's a couple questions queued up. I'm going to get to them in a minute. But if people do have a question on the bottom of your screen, should be a Q&A, and we'll try to integrate them in as we go through this. The next question I wanted to ask for you as you scale it, wasn't going to ask it before, but it'd be fun to talk about tools. I mean, a lot of times this is a more tactical issue, but sometimes it's interesting to hear what tools people are using. Could you talk about, either one of you, some of the software you're using? It could be anything from a Google Sheets to something a little bit more sophisticated. Are you using Pipedrive or Salesforce or HubSpot? Just be kind of curious as you scale what you've been using. If you could talk maybe about some of the software to help you scale. Hari, what have you been using?
That's why our fellow entrepreneurs have been extremely helpful to us in creating a lot of these wonderful tools for us. So we use as much as we can, right? So some of the tools that we use internally for communication and project management, right? We use Basecamp, we use Slack pretty effectively. Google Drive has been effective for us. Any document sharing, we use Box, we use Dropbox. Any tools that we can get our hands on to improve efficiencies internally, because as a growing company, we cannot afford to not have efficient processes internally, right? So we try to leverage as many of those tools. With our potential customers, we've been pretty effective in using a lot of the online webinar tools and web conference tools, so we don't have to be in their physical location to be able to communicate with them. That's turned out to be effective. We have a pretty robust CRM system that we have built over the last year and a half, which is also helping us manage our leads pretty effectively. So that's another tool that's come in significantly helpful for our growth.
Can you restate that? What was the one that you're using for leads and leads management? What tool?
We're using Zoho for our CRM.
Zoho. Okay. Yep, Zoho is your CRM. Cool. Mindi, some of the tools you've been using that you found effective, maybe towards the sales, leads, management, all that type of thing?
Yeah, I mean, honestly, a lot of the same stuff that Hari and his team are using, so I won't sort of, rattle those off again, but I would say a blessing in disguise is my computer, my personal computer that I use for work, has been challenged in several ways, and all of a sudden Slack stopped working a couple of months ago. And I would say that that's been a blessing in disguise for our team, because we are trying to manage both email and Slack, because a lot of our customers, everything is via email, but yet we are trying to keep some things internal via Slack. And it was a lot to keep up with, and trying to make sure that everything was in the right spot. And so we have actually done away with Slack. So that, I would say, has been an improvement for the team. Because you don't have two ways that you're trying to always communicate, but we're using HubSpot and Dropbox and Zoom and many of the other things that Hari mentioned.
Okay, Sounds good. Sounds good. All right. So next thing I want to talk about for the first couple of early customers you guys have found, and again, there's a lot of questions queued up, and I'm going to get to them. For the first couple of customers, are there any characteristics you would say for as an early stage company, if you thought back, you know, I always love, you guys may have heard my analogy, I always love a fish finder. If I want to go fishing, I want a fish finder. I want criteria for what a customer should look like. When you think about those early customers, are there any characteristics besides they need your solution for early customers that you, thinking back as you're just getting started, were some of the common characteristics you suggest other digital health founders or health tech founders look for in those early customers? Anything that they exhibited that you thought, that's what you need? Thoughts on that?
I would say here in Chicago or in the Chicagoland area, different healthcare systems definitely have reputations of being open to exploring new technologies, and
right.
you know, finding those and, you know, finding a champion within that was really important. So, you know, everyone needs medical transportation at some level, right? So, I mean, that was not a good way to narrow down. But a good way to narrow down for us was, you know, who is receptive, who might have like extra challenges due to, you know, constraints around their employees and, you know, other financial constraints, and how else can we get in, and how else have they been receptive to bringing on other startups in the past?
Okay, so receptivity to startups, open, are some of the characteristics. You know, do they have a reputation of being open, willing to work with startups? Hari, how about you? Characteristics you found in some of the initial lessons learned, characteristics you found in early customers were the best customers to speak to first to try to get in?
Sure. Some of the characteristics that we found in our early customers.
Right? If you, by the way, speak up a little bit or get closer to the microphone. Yeah, thank you.
Some of the characteristics we found in our early customers, right, were the willingness to innovate, right? They exhibited the same desire that we had in trying to bring about change. So they were entrepreneurs in spirit, right? They might have been working for larger organizations, but they were entrepreneurs. They wanted to innovate. They wanted to change. They wanted to improve, right? So that's why we didn't, you know, try very hard, you know, to try to sell to them, because those that exhibited those characteristics, right, came out naturally, right? When we had our initial discussion, you could tell very easily who are the ones that want to innovate and want to change and want to bring about efficiencies. So those emerged very naturally. So those are the characteristics for a lot of our early customers, that they were willing to try something, that they were willing to take a bet.
So can I ask, for both of you, how has your thinking matured? Like today, if you go in and you meet with an early customer, so now again, both of you have lots and lots of customers at this point, and of course want more. But now if you go in, Hari, and you have that first meeting and you get this feeling like this person is not open to change, they're not into that, do you guys just say, we're out of here? Or what do you do? Like, well, I'm trying to think of what you've learned, and I want to weave in the next kind of question. What are the 1 or 2 key lessons you've learned in selling to enterprise healthcare? You know, do you take that characteristic, and if they're not open to innovation, they're not open to change, you say goodbye. I have better things to do with my time. I have other people to go talk to. Key lessons learned, and what do you do in those types of situations?
So one of the big lessons we learned, Steve, is to never walk away from a customer. It might not just be the right time or the right place,
right?
But we always revisit them and engage them in a different way, right? So what we do use those opportunities is to learn what are some of their challenges, right? So we've been more inquisitive to ask them, what are some of the challenges that you anticipate? Even if you have happy years where they say everything is great, and, you know, we're excited, we want to get started with you guys ASAP. We always now make it a point to, you know, hear from them. What do you see as some of the practical roadblocks? Are there any limitations within your own team or within your own budget that stops you from doing it? So we're now mature as a company to ask these questions and understand more about their decision-making process, right? And in healthcare, they always say there's a number of people that can say no, right? So what we do is we've learned to try to navigate in helping address their concerns. It could be a simple email or simple, you know, follow-up with them to say, we understand your concern. This is how we've addressed it with some of our other customers. So we never walk away from any potential lead. That's a lesson you've taught as well.
Okay. Mindi, for you, big lessons learned in selling to enterprise healthcare, and do you walk away if they don't have some of those early characteristics you're looking for?
No, I would again say, you guys taught us well in that there is no walking away. Healthcare systems and payers and pharma, they're all such huge organizations, and you just have to find the right champions to hit on the right ROIs, right? So, there's an example here of the largest healthcare system here in Chicago we've been working with, but their children's hospital didn't even know that we existed. And we're looking at just working with Uber and Lyft, but they don't have car seats. And so this is a children's hospital, and that just wasn't going to work out very well from them.
Right.
And so, it took someone else outside of the organization connecting, the three of us to say, here's a solution your healthcare system's already working with. So it's making sure that you're getting into the right areas initially. I found that a lot of healthcare systems tend to be very siloed. Each department or each hospital sort of works on their own. And so you can't rely on the message getting, from one to all. You have to be pretty diligent in working your way through.
Okay. Sounds good. I'm going to take a couple of questions from the audience that have been using the Q&A function. Let me weave some of them in, and we'll go back to some of the questions I wanted to ask. Can you talk about something every company that comes into Dreamit, we spend a lot of time on this, pricing. So John Dillon asked, and by the way, when people put their questions in, if you want to say what city you're in the world, it always makes it more interesting. John Dillon asked, could you talk about your journey in figuring out your pricing? This may speak to your point about driving their ROI or how to market the product. Could either one of you just talk briefly about, as you scale your startup, I don't know if the pricing has been changing, but how did you figure out your pricing model? Mindi, do you want to talk about it?
I'll start. Initially it's kind of a guess, and it's throwing something against the wall to see what sticks. And from there, we've been able to expand in our pricing. We've got a couple of different revenue models, some transactional, some licensing, and especially if it includes EHR or care management integration. CFOs typically don't like to see variable numbers on their books. So, at scale, they want you to go to a licensing agreement either way. But initially, pricing is hard. It is hard. And I think that even within our organization, we have a lot of room to grow and figuring out what this really looks like over the next year or so for pricing. So even though we've got, people paying and our very first pilot paid, and, we've never done anything for free, we're a long ways from having this 100% figured out.
Okay, and we're going to come back to pilots in a minute. It was a question from the audience. Hari, could you talk a little bit? How did you determine pricing, or how's that changed over time as you've been scaling?
Sure, Steve. That's a great question from the audience. What has helped us, right, is to understand the financial model and the structure of our clients, right? So one of the things we did was, for the solution that we're offering to them, we tried to put that in context in terms of how much is their budget. Would they be willing to spend this much? Are we generating enough ROI for them if they pay us this much, right? So that's really what we started in terms of with the pricing structure. And then we also evaluated, should it be a percentage of revenue? Should it be a subscription price? Should it be based on location? So a lot of our early customers helped us a great deal in terms of, our interviews with them, what their threshold is, what their interest levels were. And then with a little bit of our finance background, we sort of brought all of it together, and we sort of narrowed down, this is how we want to approach it. And then we had a bandwidth that we tested, a narrow bandwidth that we tested. And naturally, it sort of, moved into something quite natural for us in terms of pricing. So I would say it's more of an art than science, but try to do as much research as you can about your clients in understanding how much would they be willing to pay for your services, and what is the benefit that you're providing for the fee that they're paying you.
Okay, do you do it? Have you, well, you talked a little bit on an ROI point, but I want to just restate what you said. So you tried a few different models and tried to see which would stick, you know, percentage of revenue, pure price, whatever it may be. And then it sounded like you did almost like a WTP, willingness to pay, right? And you did banding to understand what is the customer's willingness to pay within these different models, and just kept the classic, like, let's go talk to customers and let's go see what they're willing to pay. And then finally finalized on something where you've solidified your pricing model that way.
Precisely, and that's why, you know, some of our early customers helped us narrow that you know, pricing structure for us. That, you know, they said they'd be willing to pay on a specific pricing structure. So that helped us, you know, take that approach.
Okay, so the questions are building. I'm going to take one or two more and then go back to my questions. We'll see how many more of the audience questions. You know, Mindi, you talked about, well, and when we do pilots, and we've never done an unpaid pilot. So Alexil, and I won't even try Alexil's last name, asked, do you pay for pilots? So they asked, do you pay for pilots with health systems, and how much? Let's flip that around and just talk briefly for you both. And this can, you know, your mileage may vary with other startups. But Mindi, do you do pilots? Do you pay to do pilots? Are people paying you to do pilots? How's the money flowing when you're trying to do a pilot with a healthcare system or a payer?
Yeah, actually, I don't think I've ever heard of a startup paying to do a pilot, so I guess that would...
I've actually heard of some healthcare systems saying, if you want to do a pilot with us, here's how much it's going to cost you. And I generally see startups run the other way and go find somebody else to partner with. But yeah, that's just, your mileage may vary and it works differently, but what's your experience been, Mindi?
Sure. Yeah, so we have done pilots, obviously with our very early customers, and now for the most part, we're going straight to rollouts. Sorry for all the extra noise. We got the Blue Angels in town for the weekend, so if you guys can hear that, I apologize.
You, Kaizen Health, or the city of Chicago? I'm very impressed if Kaizen Health brought in the Blue Angels. That's quite the marketing stunt. We're in the transportation business, and we're not kidding. No.
You know, maybe we should have them pull a Kaizen Health, you know, logo behind them. But no, it's the
right.
This weekend. But no, we've never done an unpaid pilot.
Okay.
So, I just, you know, we went into the customers and said, you know, this is how we would structure the pilot. And I think from that transactional pricing for us, you know, it was the cost of the ride plus our fee. It was not an intimidating way for the healthcare systems to look at a pilot. And that was always very well received.
Okay. And I take it your implementation is not a 3-month implementation or something where you need cash up front. It's a pretty straightforward implementation, I would guess.
Yeah, I mean, we can obviously do the EHR integrations and all that, but we would never do that for a pilot. So
because it's not needed. Because real quick, we see a lot of startups. Well, we have to integrate. It's like, do it without the integration, is what you're saying.
Keep it simple. You know, we have a web-based app that's really easy to use. We trained the first 8 people that ever touched our platform in 45 minutes, and never have had to go back and train them. I mean, we have worked very hard to keep everything very simple. All the cool stuff happens on the back end, but from the user experience, we've spent a lot of time on user experience. So yeah, I mean, it's not been difficult for us to get paid pilots and customers.
Okay, cool. And a lot of that is like, how strong is your value proposition? How long does it take to onboard? You know, is it a quick, simple transaction? So I think it varies. Hari, could you talk a little bit for Yosi, you know, paid pilots, and does that mean you're getting paid or you're paying or you're getting paid, or do you do them free? Can you talk a little bit about your pilot strategy, maybe in the beginning and also today?
Sure. So thankfully, we've never had to pay for a pilot as well.
Okay. And again, if you could speak up a little bit, it's just you're a little faint.
Okay. Yeah, thankfully, we've never had to pay for a pilot, Steve, but we have done both paid pilots and free pilots. But one of the things that we've done to control the controllables with the free pilot, right, is to clearly establish the roadmap. What are the metrics we're going to track? What is the commercial price point? What is the timeline that we're going to do the pilot, right? Without those discussions, if you just run into, establishing that free pilot, one, you don't typically get a champion from the larger organization. 2, there's no skin off their back, so which means, it could just go anywhere. 3 is without establishing those clear metrics, timeline, and pricing point, it could just be a very slow death, right? So what we have done is to avoid some of those challenges. We've established, even with free pilots, here's the framework, here's what we're looking to do successfully after the pilot. here's the time frame, here's the metrics. So that's helped us sort of bring it together, even though it might be a free pilot.
Okay, sounds good. Let me go back to some of my questions. And again, we're way queued up. There's about 80 people on with us, and we're queued up a lot of questions. I'm going to hit some of mine, and then we'll try to come back to the rest of the audience. We have about 20 minutes left. I want to switch over for a few minutes to Dreamit. You know, you both went through Dreamit. You were very successful. You were, like we always say, about 2 to 3% of companies make it into Dreamit, and the best of the best make it in. And then our job's to hopefully make you even better, that you're better when you leave, because you're great when you come in. You couldn't make it in if you weren't. Make it better. I'd be curious. So both of you went through customer immersions with Dreamit. We're talking about customers. Could you talk a little bit, you know, so customer immersions, you went out, you went on a customer roadshow, you probably got in front of between 12 and 15 customers, and they're very, sometimes twice a day. It's a very intense process. I'm curious, you know, not just was it helpful to you, but what were the lessons learned? What were the lessons learned for getting ready for the customer immersion to go out and do that process? And then lessons learned for follow-up from it, if you did follow up from it. Could you talk a little bit about your experiences, getting ready, and then follow up from customer immersions? Hari, could you?
Sure.
Oh, no, Mindi, all yours. Mike is yours.
All right, so I thought the customer immersions were, you know, outside of working with the Dreamit team, of course, the best part of Dreamit. We learned so much. It was interesting in the preparation to have to get ready to talk to a healthcare system, a payer, pharma, you know, product, all maybe on the same day, and to be able to sort of switch that mindset, because the value props for each are different, and so you had to be prepared to speak to each of those. I would say that the customer roadshow was very, very successful for us. We continue to talk to probably 80% of the customers that we have talked to initially through the customer roadshow. And I would say the ones that we don't continue to talk to were more on the product side that just weren't necessarily a great fit for us and initiative. So I think Dreamit did a heck of a job putting together customers that made a lot of sense for the group, and it was a great learning experience. And even with the payers, so not only sort of the Medicaid and Medicare space that, you know, you would imagine might, you know, be challenged with rights, we're now talking to the commercial areas of those businesses as well. So it's been a great experience, and we're very grateful for that.
Good. And I think it's important to point out, Mindi, I mean, one thing that you say, and we try to set people's expectations when they come into Dreamit, in a lot of things, it's like the investor roadshow. It's the beginning of a process. You're not going to walk into a Blue Cross Blue Shield of Massachusetts or Independence Blue Cross, do a customer immersion, and walk out with an agreement, you know, 5 minutes later. It's the beginning of a relationship that may take months to close. Sometimes they close within Dreamit, and like we talk about, these are more partnering. They're very strategic type of discussions. But it's interesting to say 80% of them you're still speaking to. We wrapped up with you 6-7 weeks ago or so. So it's just all very fresh. But it's the beginning of it accelerates that process. And I think with you, we did, I don't know, 15, 17 customer immersions in 2 weeks. So interesting. Hari, customer immersions. Well, I'm not looking for the accolades for Dreamit. I'm looking more, you know, for this audience, they don't care about the accolades. They care about what did you learn to get ready for the customer immersions and what happened afterwards, like the follow-up, that type of thing. Could you talk about that briefly?
Sure, Steve. I'll even take a step back, right? In terms of us being accepted into the Dreamit program, right, was validation that we had the potential, we had a product and a platform that could be sold to these larger organizations. So that was the first step. And as Mindi said, you know, the first few weeks of the program where Mike, Mo, Dr. Phil, Annie, and all of the work that we all collectively put together, right, helped us understand all of the dynamics, the different aspects of the customer immersion program, how to fine tune and, you know, present, you know, to our potential customers. That few weeks was extremely significant for us. And what Dreamit did really for us, right, this is not an accolade, is that it created opportunities for us with these larger organizations that we otherwise would have spent 10, 12, 15, 18 months, right? We got in front of the CIO of one of the top 10 health systems in the country in our third week of the Dreamit program, right? So you created that opportunity. It was up to us as a company to have a good product and a value proposition. It was up to us to pitch well. And then it was once again up to us to do all of the follow-ups and make sure that we eventually turn that opportunity into a paying customer. So there's a lot of things that need to fall in place prior to the introduction, and there's a lot of things that need to fall into place after the introduction. And that's where each of the startup companies, we need to take the ownership and the responsibility to do everything we need to do prior and post.
Okay. You guys brought up a lot of points, and thank you for sharing some of those lessons. You know, both of you were running companies as you came into Dreamit, meaning you were running your existing company. One of the challenges when Dreamit focuses on post-seed, pre-series A kind of companies that are already up and running, it's not just, I have an idea on a piece of paper, I need to go validate it. We're not doing that. This is about helping you build your business and shape your business. Could you talk for a couple minutes? How did you balance that? It's a very hard thing to do. You're trying to onboard customers and run your business, yet at the same time go through a very intense, hands-on acceleration. And this is 14 weeks of very hands-on. We're hands-on, you're hands-on. How did you manage that besides not sleeping much, with building your business and running Dreamit? Could you maybe talk to that issue? Mindi, you were chuckling a lot as I said all that. I know you were flying back and forth to Chicago a lot, and companies don't need to relocate to Philly, but we want you to spend time with us. And even if you're not in Philly, right? You have 2 weeks of customer immersions, 2 weeks of the investor roadshow. There's a little bit of travel in there. How did you manage to fit all that in?
Yeah, so the whole sleeping thing definitely doesn't happen a lot, but I'm very lucky that I have a strong team around me.
Right.
We are also going through a small acquisition of bringing on a piece of technology and guys during this very same time. So it was quite a challenging time for sure. And the business still very much needs you. But I think it was a lesson in letting go a little bit, which is also something that needed to be done to open up and let others on the team really step up. And so I think that was ultimately really good for the team. I think it was a bit of a struggle for me initially, but I would say also that, the folks that Dreamit, brings in for, I forget what they called the sessions, but, we would have those sort of, sessions with experts in the space. They were so very valuable. And, I wish that I could have had my entire team in Philly the entire time, honestly. It would have been so valuable, but we also had customers in Chicago that needed us. And so it was definitely a balance, but I think it actually allowed our company to grow up a little bit and for others to take a step up in the company. So it was good overall, but definitely it was an intense 14 weeks.
Okay, Hari, same, and a lot of travel on top of that. Hari, same thing for you. I remember, you had customers, you had some revenue, people were, you were already in a couple of doctors or clinics. How did you manage the balancing both?
Sure, Steve. I think, if I may share our experience as a piece of advice to anyone that's on the call to join the program and be effective, what they need to think about is, you're running a company, and being part of the Dreamit program, right, is not something that you do in addition to that. Make it as part of running your company, because the value that you get out of being part of it, taking an active role, will help you fine-tune your business model, your pricing model. You're making enormous expansion of your network. You're talking to customers. So make that 14-week as part of running your operations. Set aside time. Be diligent in following up. I've sent Slack messages at 2 in the morning, and I've gotten a response back at 2:05. Right? So you have a partner that's ready to respond to you guys. So set aside a time, make it part of you running a company, right? That's what we did, and that's why it worked out well. We didn't see this as something in addition to running the company.
Mindi, could you build on that? Like, if for companies thinking of applying, and by the way, for those listening in, applications close tomorrow. So if you're thinking of applying, please do. I'm just going to take a couple questions off here, by the way. Our biggest focus at Dreamit is digital health and med device startups. Somebody said, if we're a pharma or biotech, should we apply? We generally don't do that type of life sciences, so we don't do pharmas, we don't do biotechs. We do point of care diagnostics. So, if you're, our line is, if you're on the edge and not sure if Dreamit is the right program or if you're the right fit for us, go ahead and apply. If you think you're a little too early, we'd rather start knowing about you now, apply. So if you're not sure, when you look at the criteria, it should take 10 to 15 minutes to fill out the application, apply. And when you're filling it out, by the way, please follow the KISS principle. We don't need a treatise on your problem statement. We're looking for short, succinct, get to the point kind of statements when you're filling out the application. So an application's closed tomorrow. Mindi, for those companies that are lucky enough to get in, words of advice looking back on the 14 weeks, here's what you should be ready for, like Hari's kind of shared, to get the most out of the program, here's what you want to do or don't do. Any thoughts to share?
Yeah, I would agree with Hari in trying to make this part of your company as well. I tried, even if it was remotely, trying to get, as many of my team members, watching the programs that were available to them, working with others. We had some other folks come out to Philly as well to be able to really be involved and be in that experience. I would say that it has to be something that your team is 110% behind, because it does take so much, but my entire team saw the value in it. And, we talked about it. We talked about it with our investors, and, we all decided together that this was something that we valued and we wanted to do, and we were going to give our all. And I think you need to have the buy-in of everyone to make it successful.
Okay. Sounds good. Let me take a couple more questions from the audience really quick. I'm 22 behind. Let me just see if I can take a couple of them that are really related to what we're talking about. Talent. Either one of you could take this. Are cold calls possible with a healthcare system? And what's the point of contact you would suggest? Do you guys do any cold calls at this point? Do you find them effective at all? Could either getting a no on Mindi, cold calls are not effective.
We do a lot of cold emails, and they are effective.
Okay.
Picking up the phone. No one wants to talk on the phone anymore,
right,
including myself. And
okay.
But we actually did an initiative in May and June where we sent out like 500 or 600 emails to payers, and in specific target markets, and it worked very well.
Okay.
A lot of meetings. So I would say the cold emails have worked very well. They have to be pretty targeted.
Right.
But cold emails, but yeah, picking up the phone, no.
Hari, cold emails, cold calls, anything cold would work for you at all?
I'd echo Mindi's sentiments, right? In our case, because we're talking to also smaller clinics, right? The cold calls sometimes could be made effective, especially if you're not trying to sell to the person that's picking up the phone. No one wants to pick up a phone and buy something, right? So what we've done effectively is to find out who the right stakeholder is so we can share some information with them, right? So now we've built our marketing database pretty effectively with some of those cold calls. But that's really what we use it for. We've never used cold calls to sell anything. We just get some critical information that might help us share some of those cold emails with our contacts.
All right, let me a couple more questions, then I'm going to wrap up here in a couple of minutes. One of the questions, this is from Eduardo Mercado, asked, how do you deal with IT departments having been backlogged seemingly with bigger priorities? And that seems to get worse over time. And I think that the classic thing that we all hear is, well, we're in the middle of an epic upgrade. I mean, it seems like everybody's always in the middle of an epic upgrade. So for both of you, when you're trying to sell into these, sometimes IT can get in the way. We'd love to do it, but IT can't handle it. How have you dealt with that? And also, I'm going to integrate two questions at the same time. HIPAA. Do you deal, when you're dealing with, trying to get customers on board in healthcare, how are you dealing with HIPAA and IT saying, sorry, we're busy?
So I'll
Mindi?
take that because we've gone through both. So we got an outside HIPAA audit done
Right.
to give us a little bit of credibility, and we've still had to go through some pretty intense security reviews with the bigger healthcare systems. That being said, really staying to that web app and keeping it simple. There's not a lot of lift or any lift on the part of IT for us to get up and running. We want to get in there, prove the ROI, then we'll worry about integrating with the EHRs and integrating with the care management platforms. Once you've got that, champion in there for you, it's not necessary necessary for us. And I would say, trying to build a business where it is necessary is going to be a pretty big barrier, but that's been our experience is keep it really simple. I'm a big fan of the KISS acronym as well.
Okay. Hari, for you guys, you almost seem like you'd have to integrate in with IT. How do you deal with the challenge of IT departments and also HIPAA compliance?
Sure. And that's why before you speak to any of these larger organizations, you need to have a core infrastructure in place to address all of the HIPAA guidelines and compliance areas. Because if you're not ready with those, and if you're starting to talk to these organizations, you're going to be slowed down eventually because they're going to do an audit, they're going to do a review. So be prepared, do all of your groundwork and due diligence with regards to your own HIPAA compliance program, and then start effectively talking to these larger organizations. So that's what we did. We had our own compliance officer that put a program together, and that's actually when we started talking to the larger organizations. With IT, you're absolutely right, Steve. We've heard that same line with at least 50 organizations. They are all in the middle of that upgrade. So what you need to do is just sort of break it down and convey to them that they're not doing a lot of the IT work. They're making introductions, and we're doing the IT work or the implementation of it. So ease them as much as you can, because they are concerned that they're going to be doing more work because of this pilot, right? So to the extent that you can, let them know that you're willing and happy to do some of the work. You'll continue to be engaged, and you'll continue to make it easier for them to implement your product. So help them relax a bit, ease their concern. That's helped us so far.
Okay. Mindi, somebody asked a quick question, by the way. Can you talk about who did you hire to do your outside HIPAA audit? Can you disclose that? Is that okay, or do you feel comfortable?
Yeah, it's Karosh Compliance. It's
Karosh Compliance.
Karosh Compliance.
Okay.
They're based in Indiana and did a fantastic job.
Okay, terrific. Hari, there was a quick question Laura B asked, did any of the free pilots sign up as customers afterwards in the end?
Yes, they do. And that's where establishing those metrics and the time frames and having those clear guidelines help you, because once you get to that point, then you continue to move those discussions and get them to sign up. Yes.
Okay, terrific. One or two other key questions. I'm going to answer a couple questions that have been coming in. A lot of the questions coming in, by the way, if you want to get the answers, if you're looking to apply to Dreamit, if you go to dreamit.com health and near the application, you'll see FAQs. A lot of the questions that are coming in right now, if you just look at our FAQs on our website, they'll answer them. Somebody asked if a replay of this was going to be available. Yes, just follow us on our Dreamit Twitter handle @Dreamit. And there'll be a link in the next couple of days with a rebroadcast of this and where you can find the whole thing from top to bottom to answer that question. And then any other closing comments? I mean, we've been going through talking about scaling your startup, scaling customers. You both went through Dreamit. It seems like you both would think Dreamit was worthwhile for scaling, and also the Investor Roadshow, it worked well for both of you, I would hope. It sounds like it did.
Yeah, I mean, I'm not always the biggest proponent of accelerators, and in fact,
I forgot about that. No, it's right. Yeah.
Was a little skeptical of Dreamit. At first, did my due diligence and was actually quite impressed, which is the reason we ultimately ended up joining. So kudos to Dreamit for being different and for putting on a wonderful yet intense program. Our business would not be at the place where we're scaling into Philadelphia and New York this fall without Dreamit. So I would say if you're considering looking at Dreamit, definitely give it a go.
But remember, it's a two-way street, right? You worked your ass off, and you continue to, right?
Absolutely. Absolutely. And probably more so because of you. I wouldn't quite call him a slave driver, but he kept on top of us for sure.
Pushed pretty hard. Hari, everything worked well for you, and any other closing thoughts that you have on particularly around scaling, that type of thing?
Sure, Steve. As we just discussed during the last 45 minutes, right, there are a number of challenges for health, technology startups, from pilots to financial challenges to how do you scale your business, right? So what we found was that Dreamit was a tremendous partner for us in helping address a lot of those things very, very effectively, right? So that's why anyone that's, that's on this call that's contemplating or thinking about applying, drop the webinar, go ahead and apply. I seriously urge you guys to do that, only because you will actually be better off for just going through the application process, even if you don't get selected, because it is a very selective process and it's a great validation for our business, right? We made some tremendous network and introductions with some large investor groups. We were not a good fit, when we spoke to them. That's great, that's fine. But we've established those relationships. We've used Steve's suggestion to have specific follow-ups, and now we're getting close to the point where we're looking to re-engage them. So those opportunities, those doors that open up are tremendous for just growing your business. So we've had nothing but a fantastic experience, and I can't thank the Dreamit team for putting all of those meetings on my calendar and all of the other companies. That's just a monumental task.
Yeah, no, but you guys are also the same thing. I mean, it's a two-way street, right? It's a lot of work for you, and we understand that, and you continue to execute well. Mindi and Hari, I'm going to wrap up here. Really appreciate your time today. Great to touch base with you guys again. For everybody listening in, applications close tomorrow, I guess, midnight Eastern time. So you have about a day and a half left to get them in. Please apply. If you're on the edge and thinking about it, you're not sure, is it the right fit? Are you right stage? Go ahead and apply anyway. We'd start to build the relationship with you. Again, keep the application simple. Don't bury us with detail. That's the wrong way to go. A little bit on the lighter side. Just stay focused on answering the questions. Thanks. I'm sorry we ran over a few minutes today. Really appreciate it. We're going to end it here. Steve Barsh from Dreamit in Philadelphia. Mindi, Hari, thank you. And for everybody dialing in, thanks so much. Have a good day. Take care. Bye-bye.